Thank you for selecting that. Let me ask you something most people don't like to think about, but should. What would happen to your retirement if you or your spouse suddenly needed long-term care? Not just for a few weeks, but for months, or even years. The truth is, long-term care is one of the fastest ways to drain a retirement account. Today, the cost of care can easily run thousands of dollars per month, and for many families, that expense shows up at the worst possible time, when income is limited and options are few. What surprises many people is just how common this situation has become. Many retirees assume Medicare will cover long-term care, but in most cases, it doesn't cover extended custodial care. That means the responsibility often falls on your savings, your investments, or your family. And I've seen situations where years of careful planning were undone because one unexpected care event forced large withdrawals, reduced income, and created stress that could have been avoided. Now, some people have looked at traditional long-term care insurance in the past, but many walked away because of one major concern. If you never use it, the money you paid in premiums is simply gone. That's a tough pill to swallow, especially for retirees who have worked hard to build their savings. And others worry about rising premiums over time, which has happened to many policyholders. That's why more retirees today are exploring a different approach. Strategies that allow you to reposition a portion of your assets so they can be used for long-term care if needed, but still remain part of your estate if care is never required. In other words, instead of paying into something you might never use, there are ways to structure assets so they can serve multiple purposes, providing protection if care is needed, while still preserving value for you or your family. But just like with taxes, timing matters. The earlier you understand your options, the more flexibility you typically have. Waiting until a health event occurs can limit choices and make planning much more difficult. I've seen families forced into decisions under pressure simply because they didn't know what options were available ahead of time. That's why we offer a personalized retirement care planning review. Not a sales meeting, not pressure, just a conversation to help you understand how a long-term care event could impact your retirement, what options may be available to help protect your savings, and how strategies like asset-based coverage might fit into your overall retirement plan. Because long-term care isn't just a medical issue, it's a financial one. And if it happens, the question isn't just who will provide the care, it's how it will be paid for. So if you haven't already, go ahead and schedule a time to have that conversation. No pressure, no obligation, just clarity. And when it comes to long-term care planning, clarity can make all the difference for you and the people you care about most.